Welcome back to the Morning Blend. Whenever you're faced with an illness or injury, the road to recovery can often be a struggle, but it doesn't have to be. HealthSouth Acute Rehabilitation Hospital. They are a higher level of care that aims to get you back on your feet quicker.
Here to tell us more, Area Director of Marketing, Nancy Ignacio. Also with us, Community Marketing Liaison, Diana Sudavarch. Good morning to both of you and welcome.
Good morning.
Thank you. Nancy, let's start with you. What is HealthSouth Acute Rehab?
HealthSouth is the nation's largest healthcare provider for inpatient acute rehabilitation hospital. Been around for over 30 years, and we have now over 120 inpatient rehab hospitals nationwide. Our priority is to provide high quality care for our patients after a stroke, traumatic brain injury, neurological disorders just like multiple sclerosis, Parkinson's, and illnesses and surgeries.
And I've seen those HealthSouth signs all across the nation. Diana, well, let's talk to you. How do you find your patients?
Well, most of our patients come from the acute, they're referred from the freestanding acute rehab, acute hospitals, such as, you know, the Dignity, the St. Rose's, and Summerlin, and all the other ones. But from all over the valley, all over Clark County, Mesquite, and Laughlin, but we also get referrals throughout the states. Sometimes you have, you know, Nevada residents who go out and, you know, something unfortunate happens and, you know, we'll get calls from California or New Jersey. But in the recent few years, we've seen an increase of referrals from home. Because we are an acute rehab hospital, we can direct admit patients from home. So if somebody decided to go home from the hospital, they didn't want to come to rehab, or they're experiencing frequent falls, unsteadiness, having difficulty rising in and out of chairs, difficulty with their activities of daily living, bathing, dressing, they can call HealthSouth, and a clinical liaison will go to their home, do a no-cost free assessment.
Great.
Our medical director reviews, and we can admit them to rehab.
So you could go to the facility, or they could do it via the phone and get it all taken care of?
Yeah, we are a hospital, so we're at post-acute recovery. We provide the same acute care services like a hospital, especially with the healthcare reform that has happened in the last few years. Anything that's a patient who has non-emergent or urgent situation, we can have a nurse go into that home and assess the patient. We have a medical director that reviews. If the patient meets criteria for acute rehab, we can then transfer that patient that same day.
Wow.
And the great thing about it is it does prevent patients having high risk to go back into the ER. And our goal again is to increase their mobility, their strength, their endurance. Can we get them closer or back to their prior level of functioning? And the good thing about it is it gets them back home safely.
Of course, and that's the goal, obviously.
Correct.
Is this something that's covered by insurance?
Yes.
Great.
So we take Medicare, Medicaid, we take private pay. We also take a gamut of commercial insurance, Blue Cross, Teamsters, culinary, and other types of insurance. We can have our admissions department check if they provide acute rehab.
And what sets you apart from other rehab facilities, would you say?
You know, I think there's a misconception out there that all rehabs are alike, but they're not. HealthSouth is the only freestanding acute rehab hospital located in Las Vegas and Henderson, as we have 3 locations. We have one in Henderson that services the Henderson area. We have one on the southwest, and we also have another one on Charleston and Valley View. And so it is required and mandated for a patient to go to acute rehab to be seen by a physiatrist, which is a rehab specialist physician, and it's also frequent daily physician visits. We have coverage. It is 24 hours. They're all registered nurses. Some of our nurses are certified rehabilitation registered nurses, so they have to go through a rigorous training. And we also have wound care certified nurses for some patients that need wound care there. We do 15 hours of therapy. We do physical therapy, occupational therapy, speech therapy, and it is 15 hours, 7 days a week. And so we do have some specialized therapists there. We have Vital Stem certified, which is for a patient who has dysphagia or difficulty swallowing. So it's electrostimulation to help with people who are having difficulty swallowing to assist them. And we also have neuroinfra, which is a specially trained therapist that is certified for patients who may have suffered a stroke, brain injury, and now has paralysis.
It's very comprehensive,
No
it
question.
seems, yes. And you know, we all hear about physical therapy and why it's so important, because if you've broken something, you've had a fall, you're older, you want to get that range of motion back as soon as possible.
Correct.
You know, and get
because
yourself
the muscle
healthy again.
has such short
atrophies,
memory,
And-
so it's very important.
Yeah.
It's great having you, ladies. Thank you so
Yeah,
much for joining
Thank you
us.
so much.
Thank you so much.
Thank
I
you, guys.
appreciate
It's
it.
great having you. Get the greatest possible outcome in your recovery with HealthSouth Acute Rehabilitation Hospital. They have locations in both Las Vegas and Henderson. And for more information, be sure to visit that website you see on your screen. You can also call the number listed.